You are watching Access LaPorte County, Channel 97. Coming up next is the January 23rd, 2024 meeting of the LaPorte County Board of Health. You can find more information for this meeting by visiting www.accesslaportecounty.org.
So I have just after 4 o'clock. We can get started whenever you'd like. Julie Davies is absent this afternoon, so I would be doing roll call.
Okay.
And Dr. Dora, you'll be kind enough to run the meeting, right?
Okay, I will.
Thank you.
Mrs. Arnold,
Present.
Dr. Dora,
Here.
Dr. Uhas,
Here.
Ms. Lon,
Here.
Dr. Manning Cox, Dr. Nelson, and we have a quorum.
Hey.
Okay. First to be election of officers, and I guess we can start with the president. Do I hear a nomination?
I would like to nominate Dr. Uhas.
I'd second that nomination.
Okay. Any discussion? Okay.
I think she did a great job the past couple of years. I think she'd be great again.
I agree. Okay. Everyone in favor say aye, or do we need to vote in? Okay. Roll call vote.
Are there any other nominations?
We didn't.
So I have to do a roll call
Motion for
because
nominations to cease. Okay, to hear motion for nominations to cease.
I move that we close nominations.
Second.
So Mrs. Arnold,
Aye.
Dr. Dora,
Yes.
Dr. Uhas,
Aye.
Ms. Lon,
Aye.
Dr. Manning Cox. The ayes have it. Congratulations, Dr. Uhas.
Thank you. I appreciate your trust, and I will try to revive to come to the next meeting in the flesh. Dr. Cox, you need to turn your mic on, hon, when you're talking. It's kind of like you turn it off or turn it on, but if you're talking and it's not on, I just don't hear anything.
Okay, thank you. Thank you.
Thank you.
Okay, next will be vice president. Do I hear a nomination?
I nominate Dr. Dora.
I second that nomination.
Any other nominations? Do I hear a motion that nominations cease?
I move that we close nominations.
Second.
Okay.
Mrs. Arnold,
Aye.
Dr. Dora,
Aye.
Dr. Uhas,
Aye.
Ms. Lon,
Aye.
Dr. Manning Cox.
Aye.
Hey.
Thank you.
Okay, next will be selection of legal counsel. Do we have a nomination?
I'll nominate Shaw Friedman and Associates.
Second.
I'll second that nomination.
Second.
Okay.
Sorry, second.
Is there any other nominations? Do I hear a nomination or a motion to close nominations?
I move that we close the nominations.
Second.
Mrs. Arnold,
Aye.
Dr. Dora,
Aye.
Dr. Uhas,
Aye.
Ms. Lon,
Aye.
Dr. Manning Cox.
Aye.
Ayes have it.
Okay. We have approval of minutes from both the July 18th and the October 24th meeting. And do I hear a nomination to accept the minutes?
I move that we approve both the minutes of July the 18th and October 24th, if that's acceptable, to do both simultaneously.
Yep.
Yes.
Second.
Second. Okay.
Mrs. Arnold,
Aye.
Dr.
Well,
Dora.
look,
Aye.
could we have a quick discussion on this motion?
Sure, certainly.
Okay. The only question, I read it was lengthy, and the minutes from the last meeting were lengthy about that pool main drain. The only thing I had as a question after reading it is they had promised us a letter, a hold harmless letter. Did we ever get that? Attorney Nirenberg, do you happen to?
Excuse me, doctor. Yeah, I'm battling a cold here. We did. In fact, I think Amanda passed it out at the last meeting.
Yes, and we do have that on file.
Okay,
Yeah.
so we already had that.
Yes.
Yes, ma'am.
Okay, I'll go back over and look for that. Thank you. That's all I had. So we could vote if you guys are ready.
Can we close discussion? I move that we close discussion.
Second.
Second.
Okay, ready to vote?
Mrs. Arnold,
Aye.
Dr. Dora,
Aye.
Dr. Uhas,
Aye.
Ms. Lon,
Aye.
Dr. Manning Cox.
Aye.
Ayes have it.
Is there any public comment? Okay, next to be the health officer's report.
Good evening. On Happy New Year to all as I started with this. And again, as we know, COVID's still with us. And for the foreseeable future, more than 1 million Americans have died from acute COVID since the pandemic. And now the biggest issue for a lot of people, although people are still dying from acute COVID, is the complications of long COVID. The death rate is continuing to increase with regards to that. Right now, we know that at least 5,000 Americans have died, or their death has been attributed to long COVID, and there's feeling that it's vastly underdiagnosed because people are dying of heart disease, heart failure, and they had COVID. So sometimes it is just put down as heart disease, and in fact, probably with hindsight, many of these cases were at least associated with long COVID, whether directly caused by. And it's common. At least 7% of Americans are thought to have some degree of long COVID. And they expect it to increase over the years as more and more people have acute COVID. There's no end in sight of acute COVID. Although one of the good things since I wrote this is it is the level of COVID has settled down again. When I wrote this for our meeting 10 days ago or whatever it was, when I wrote it 10 days ago, the numbers were still increasing for all the respiratory illnesses, including RSV, flu, and COVID. Over the last week, the numbers seem to have kind of settled. They're still high, but have settled. So, so far there's been 7 million cases of RSV, and 73,000 hospitalizations and 4,500 deaths. And again, that, as I did mention in my report, that has slowed down. Fortunately, only 7% of adults and 8% of children that are eligible for them have had the vaccines. And for COVID, it's 19% of adults and 8% of children have had the most recent COVID vaccines. Flu shots were, again, when I wrote this 10 days ago, 42%. I suspect it's probably running right in and around there. The JN1 variant is accounting for 45% of cases that are actually tested. And they thought it spreads a little bit easier than some of the other variants. But it does not seem to be quite as deadly as some of the other variants. So for that reason, we are pleased. So current vaccine is effective against the newest variant that we're aware of. The other thing that, and again, since I wrote this, it's become even more probably in terms of number, is the measles. There's an estimated 9 million cases and 136,000 deaths of mostly children. With things that are going on in some of the war zones, apparently the numbers, these even 10 days ago, I looked this morning and they're vastly underrated, is that there's been horrible explosions of measles and chickenpox in a number of the war zones right now. So in 20,000, it was thought measles were declared eradicated in the United States. But unfortunately, because of some of the anti-vaccine movement that has come on even before the issues with COVID, there's been a dramatic increase globally and in the U.S. We know, and the kids are dying from this, not necessarily so much here locally, but because of better health care, but certainly around the world globally. It's quite bad. And the CDC predicted 19 million lives globally will be saved by the measles vaccine between 2021 and 2030. I mean, that's a huge number. But again, the same thing with chickenpox, because of the vaccine hesitancy, that has also the numbers seem to be increasing. And people think of it as just a simple childhood disease, but there are a number of deaths yearly from these simple childhood diseases. So, again, all we can do is encourage people to get vaccinated. I think that's it for me. Any questions?
No question. Thank you. Has anyone looked at the impact of the migrant populations coming into these various cities, whether or not there is those type of communicable diseases among that population, and whether or not it will possibly impact the cities that accept those large migrant
Yes, yes, and yes. I think to all of those, they are looking at it. Unfortunately, this is still a relatively new phenomenon with these huge groups of people coming into the cities, and so many of them being housed. Is that, and they're also moving around. So it's according to what I read, it's been quite difficult to actually quantitate how many cases are in each area, because they'll be in one part of Chicago, for example, and then they move to a completely different city, and there is still some issues. You may know more, I may have seen anything more, but the answer is, I don't think anybody doubts that there's an issue. I don't think that anybody doubts that it's increasing, but I don't think anybody has been able to truly give you a number. We've got a 20% increase or anything like that. I know that public health in a lot of these areas are doing their absolute best to get them vaccinated against whatever they can, depending on the age group of the individual and that type of thing. I know there's been a big push in Chicago for sure to, in parts of Chicago, I shouldn't probably lump all of Chicago together, although I assume it's the same. The public health there is trying to get out to these places, out to the schools where these kids are getting in, out to some of the shelters that people are at, and offering vaccines.
Do the public health officials even have access to their vaccination history?
I would guess 99% of the time, no. I mean, maybe some people, if they were in a more stable situation before they decided to migrate, could have some kind of vaccine record from Guatemala or someplace like that. But I think that's extremely unlikely. I would say basically they're having to start over for a lot of times. That actually is my opinion, not my knowledge. Some may more be coming with their records that I'm aware of. But they're not going to be able to get them from the countries that they come from.
I really thought there was a policy in the United States, I'm just talking from memory, years ago, that if you were immigrating to the United States, you would have to have your vaccinations updated or up to date, and the record. I just seem to recall there was an active.
I don't think
measure.
that counts when you're swimming across the Rio Grande.
Sorry, what?
To do all those kinds of things. I said with the way they're not coming into airports and that type of thing.
No, I know that. So
that's why I don't know that there's any way. And once they're across, I don't think people are being turned back because of lack of immunization records. But
all I'm pointing out is that this is a departure from what it used to be, as I recall. That's all.
Yeah.
No, I understand the hurdles and why it's difficult.
Dr. Uhas, I believe that is still the case. When my son-in-law came, he did have to go through a series of tests and bring all of his records, and that was recent.
May I ask where he came from? What part of the world?
Sure, yes. He came from Egypt, but he got stuck here during the pandemic, right when we closed down, and the Egypt airport closed down as well. So he was kind of stuck here, but luckily he had everything with him because he was beginning the process. But as somebody had mentioned, and I don't know who to attribute this to earlier, when they're coming in bulk from the south, right, they are not carrying that type of information. So that's where the problem arises. But if you go the normal route, then they still do have requirements for the vaccines, in my experience.
I agree.
Thank you. Thank you both.
Anything else?
Any other questions?
I can just add to that. I know Allen County is has a large refugee population that comes through. That's one of the import areas for refugees, and they have a very active clinic and immunization program there just for immigrants and refugees. So that might be available on their website. I'm sure it is. Just to, if you wanted to dive in a little bit there to see what's in that county.
And other infectious disease, public health seems to be associated with this population as TB.
I'm sorry, I don't have the current, I don't have the numbers, do you know? But I mean, I know that it is definitely an issue. Again, one of the articles I was reading again specifically about Chicago, which is a step after coming into Texas, that type of thing. But I know that there's been a lot of TB testing going on, but I can't give you numbers, I'm sorry.
Well, we had a population here that we were concerned about in LaPorte years ago. And this isn't like last year. I'm thinking like 5, 6, 7 years ago. I remember hearing about the concern for TB. Because the people that are infected also have to be concerned. These are bad diseases. So
We were just talking about, there was an active case, and then the whole people in the company had to be, but there wasn't, to best of my knowledge, there wasn't a number of that many people. There was just one active case. So
okay.
yeah.
Are they still doing the vaccines in schools, you know, the MMR and that kind of thing?
In schools,
I don't know of any schools that are doing them in school, to be honest. They're all done through health that I'm aware of. I don't know if there's...
Are they participating? Like, that's another thing, you know, when I was a kid, somehow or other, I got a pox scar on my arm, and I know I had to go and get it done in order to go to school.
I'm sorry, I don't think I understood the question.
I'm not sure I explained it, but I just wanted to know if kids today going to school on any level have requirements for immunizations.
They're not done at school. They're done.
No, but
Okay, yeah, it's they have to. The moms have to, but yeah, the schools have regulations for this.
okay.
Okay.
Yeah, can I say something? I know in DC that the parents, they're given the requirements that the kids must complete before they could register for school. And that's one of the requirements, the vaccination portion.
Yeah.
And the parents have to make sure that their doctors, they're sent to clinics if they don't have private doctors in order to get that done. But the schools no longer, they did, but they no longer have that particular responsibility. It's up to the parents.
Yeah, I don't think it's not a school policy that I'm aware of.
Okay.
So they do have to have their immunizations, and they will
Policy to do the immunization
there. They'll get excluded from school by a certain date.
Yeah, that's right.
Unfortunately, there's a high
Non-compliance.
non-compliance in the state of Indiana when it comes to childhood immunizations.
But people do have a way to opt out because of religious reasons, right?
Yes.
And can I make another point? Maybe Indiana, the public health, will have to start coordinating with other states, because when the migrant population kind of populate these states, they're going to have cooperation with other states to send these particular population in order to spread them around. And maybe that's something that, instead of just busing them over to Indiana, because you can't control the other states, that should be one of the things that they need to really talk about within the department, to make sure that those are the kinds of things that are done in maybe Chicago and some of the other sanctuary cities or states, to have that's a requirement. So maybe that's something that, the different populations, and particularly since LaPorte County is close to Chicago, and there's a lot of call for migrants workers here, that might be something that needs to be looked at or noticed, when we are considering, letting them come to work in this particular area.
I don't quite know how how we would do that, to be honest. We can encourage it, but I don't know how as a local public health office we can offer it by way of advertisement, but I don't know how we would do an outreach for this type of thing, if that's what you're talking about.
Well, it would have to be the state public health to be able to do that, and then coordinate that with the local boards throughout the counties to make sure that those things are done or they're in place, or that these are things that they have said, well, look, this is in order to prevent, a pandemic or epidemic of this outbreak of these different diseases.
It could be part of a working visa.
Right. But but it's just knowledge. It's just the knowledge is power.
Yeah.
And for us to protect our population, even though we're such a contiguous area, that whatever happens with us happens with others and vice versa. So if we had that talk and we're cognizant of those type of issues that could become a problem, then we need to just discuss that and throw our name out. These are some of the things that we would like to, to be aware of.
It's a good point.
So are we done with the health officer's report?
Unless there's any more questions.
Do we have a motion to accept the health officer's report?
I move that we accept the health officer's report.
Second?
Second, yeah.
Mrs. Arnold?
Aye.
Dr. Dora?
Aye.
Dr. Uhas? Dr. Uhas?
Aye.
Sorry, I had my mic off. Ms. Lon?
Aye.
Dr. Manning Cox?
Aye.
Next is the administrator's report.
I can leave that on. So end of 2023 brought the completion of 1 full year of our FEMUR program, which, I put in the report. I was very proud of, and I am still very proud of that program that we were able to get up and running, again, with the help of the Healthcare Foundation that funded us for the first year. We have applied for the PIN grant through the state. We received a grant to continue that program for the next 2 years, using combination of the PIN grant money along with our Health First Indiana funds. So that program is in place. It's working very well. You can see the number of cases that they were able to review from 2020 and 2021. 13 infant deaths in 2020, with 10 of the cases being able to be reviewed. 3 of the cases, some of them have moved out of state, not able to get records. So if we ever get that information, those cases will be reviewed. So same thing with 2021, we had 6 deaths with all of the cases being reviewed. In 2021, there were 0 deaths attributed to unsafe sleep. So that's huge, especially for LaPorte County and Indiana overall. LaPorte County does have a higher fetal infant mortality rate death. So to see 0 on unsafe sleep, hopefully that trend continues.
What does asphyxiation death mean if it's not in their sleep? How does a child die of a baby die of asphyxiation? Is this like an accidental asphyxiation, or someone rolls over on them? But I don't understand what asphyxiation death is.
Yeah,
Rolling over would be one of those.
going
Yeah.
down into, it could be on a couch and roll down face down onto a couch because there's no beds.
Okay, so that wouldn't be considered an unsafe sleep death. That's considered an asphyxiation death. It's on the. You have
Oh, I see
unsafe
that.
sleep
Yeah.
and asphyxiation. That's why I'm confused.
Right. So without being able to speak specifically to those 2 cases, it would be something that that the child was put into, possibly a bouncy seat or something like that, left with something in with them,
Okay, like a toy.
with a toy or a blanket or something that
Down into the throat.
right.
And also the curtain, the blinds, microphone, those the strings.
I don't know, because that would not,
There's a lot of, there's a call
That was just
for
anybody.
industry
I don't know that that would
to
go
do
into
something
this.
about that, to get rid of those types of.
Babies have pneumonia now, spray.
Right. Your mic's not on, doctor.
Sorry.
Right, so so there's a number of things. Asphyxiation would be anything that would be covering the mouth or getting down into their throat while the child was asleep and not sleeping. Yeah. So I did attend several meetings with DNR concerning septic systems. One of the main projects or grants through the coastal areas in the Great Lakes. A huge point for the state of Indiana, for the counties along Lake Michigan, where septic systems mean that non-point source pollution into the lakes and waterways. That program, that grant period for the DNR is coming to a close. It will be finished this year. To bring that full circle, Ashley Sharkey with the DNR, who has been the program coordinator, is bringing together a education day for realtors. That's been a huge hurdle for the area altogether, to be able to reach out to realtors, to help us, to help them, to help new homeowners, to teach them what septic systems are, how to maintain them. We were able to get, or so she was able to get continuing education, CEUs for the realtors, that they have to get so many a year, so they will be able to get CEUs for this day. It's going to be held at Red Mill Park in April. We do have a national speaker that's coming. Dr. Sarah Yeager is a professor in Minnesota. She's president of the National On-Site Wastewater Recyclers Association, NAWRA. She goes all over the country and speaks on top of her duties that she has at the state and teaching. So that's kind of exciting that she'll be here in Little Northwest Indiana, LaPorte County, helping us educate the realtors. And I'm happy to see that finally happening. It was part of the DNR, that program that was able to help us bring in originally that IOPA certified inspector course. It was the first one held here in, not the first one, it was one of the early ones, but the first one that was held in LaPorte County right at the beginning of our property transfer, to get inspectors ready to go for that program. So that is exciting. And it will be a whole day. Myself and Porter County, probably Dan Boyd from Porter County, will be speaking, or hoping to get somebody from Lake County to also participate in that day. So it'll be interesting to see how that all comes together, but that's good, and it's going to be in our own backyard, so that's even better. I'm still working with the TRP. There's been some hurdles there. We still haven't been able to approve an ordinance. There's been some back and forth. I think we finally have a procedure in place, and about the items that will and will not be able to be included in an ordinance. Right now, I have to go back to our ordinance that was approved earlier by the board. It has been submitted to the commissioners for review. I do have to go back and eliminate some items that, knowing now that the TRP will not approve. So those items have to be removed from our proposed ordinance. So hopefully here pretty soon, we'll be able to pass one. But in February, we should have several to review. Right now, since legislation is in place and there are several bills out there that could affect septic systems and how they are managed within county health departments, we wanted to wait till the end of the legislative period. We didn't want to approve ordinances and have some legislation change and then have them put them through the whole process again, because it is quite the process. So stay tuned. I believe the meeting is the end of February. And
What items are being removed? from the ordinance.
for the ordinances. So we had, one of the items that we had was being able to license them, or not license, register and bond. We can still register, we can't force them to be licensed or insured and bonded, especially if they're already insured and bonded with the building departments, if the county has a building department. There's a loophole there, I should call it a loophole, but some counties don't have building departments. So if for some reason they don't have a building department within that county, the department would be allowed to require insurance and bonding. We have a building department in our county that does register, bond, and require insurance. So we will no longer be able to do that with us. The other item was D-boxes, having risers to the surface on a D-box. That will not be allowed in ordinances. Having additional risers over septic tanks or dosing tanks will not be allowed. Anything outside of the minimum that's inside the rule. So those are two items I have to remove. And obviously right now it's interesting, there's two bills in the House right now. One is for a statewide property transfer program that's been tried for several years to get that passed to go through. And there's another bill that is outlawing them altogether. So we'll see which prevails, if either one prevails at all. So, yeah.
I'm sorry, Amanda. What is it that they're outlawing altogether?
That you can't require a point of sale inspection on a septic system.
Similar to what Representative Pressel said at the last meeting?
Correct, and that's his bill.
All right.
To ban them statewide. One of the other bills right now is to prevent health departments from doing any type of septic inspection at all on a property after it has been initially inspected after installation. So if there is a report of the septic system failing, we would not be allowed to go on the property to inspect that. So I don't know where that is at right now, if that's out of committee and it has not been voted on. I believe it's still in committee.
Would the department be allowed to request from the homeowner an inspection to go on their property?
I don't know that I can answer that for sure right now.
Okay. All right.
Yeah. We might be able to request, currently we're able to request them to get an inspector. I don't know that we would be able to going forward. It depends on what the language is, and I don't have that in front of me, so I apologize.
No, I understand. Thank you.
Yeah. There was a lot of confusion with the health board this year. If you remember when I went back, we were talking about this last year, and Senate Bill 4 legislation was saying that health boards had to increase their number by 2, so we would have 9 members instead of 7. That was changed at the end of the year because there was a lot of pushback from the smaller counties that are already struggle to get 7 people on their board. So then it was decided that if you have the cutoff is 200,000. If you have over 200,000 population within your county, you have to have 9 members. Under 200,000, you can stick with the 7. But out of that, we had to give up 2 positions. We had to give a seat to the county council is now allowed to appoint a person. And the mayor of the largest municipality has a list of professions that they can select 3 names and present to the commissioners, and the commissioners pick from that list of 3 names. So our largest municipality is Michigan City. The commissioner's office has been working with the mayor to get a list, and hopefully by our next meeting, hopefully by next month at the next commissioners meeting, we'll know who our 7th member will be. So some of your appointments might be a little wonky. Dr. Dora and Dr. Manning Cox, you were up at the end of the year. So to get everybody back in line, you only have a 1 year and a 3 year. So next appointment, if you still want to stick with us, everybody will be 4 years going forward. Unless they're filling a position. If somebody leaves in the middle of theirs, the new person that comes on would fill that out. It's clear as mud, right? Yeah, and then things are always. We had plenty of time to do it as appointments ended. We were supposed to be able to make those corrections going forward, but then it got to the end of the year. And in November, after our last meeting, the state said, no, you have to get your board in compliance by the first of the year. So that's why it was such a shock and a stew there at the end. But it all worked out.
I have an open spot right now from Nurse England.
Ellie, we can't hear you.
Oh, I am so sorry. So we currently have an open spot right now because we did have a temporary fill-in that was a Nurse England, right?
Mm-hmm. Yeah.
I believe she moved out of town.
She moved out of county.
Okay. So so we're still expecting someone to take that spot, but is that going to have to be then an appointment that is originally designated by Mayor Angie out of Michigan City, and then someone's going to have to dictate out of 3 there? Is that where that spot's going to have to be filled?
So what happened there is actually Dr. Dora is filling that spot now. He has a 3-year appointment. So the mayor will have her appointment will be a 4-year appointment. So then that 4-year appointment follows that election cycle within the city as well. Yeah. So every 4 years, that appointment could be a new person. Mm-hmm. So, yeah. And I think I'll cut it off there. If anybody has any questions, I'll be, like I said, I'll try to answer it or I'll make it up.
I move that we close the administrator's report.
Is there a second?
I'll be accepted.
Mrs. Arnold?
Aye.
Dr. Dora?
Aye.
Dr. Uhas?
Aye.
Ms. Lon?
Aye.
Dr. Manny Cox?
Aye.
Ayes have it.
Okay, next is Environmental Health Food Division Supervisor's Report.
That'll be me again. Trisha is unable because she had a previous engagement that she wasn't able to change. So some of the highlights there, we're always doing what we're always doing. There was new rules that were established for the pump and haul permits. So now under legislation, you have to have a yearly permit. You have to have a written contract with the service provider. So we were reaching out to our previous pump and haul to let them know what those legislative changes were and what they had to do to come into compliance. So we had between 20 and 30 permanent pump and haul homes, and they will now be permitted yearly with a yearly permit with a yearly contract from a service provider. And they have to be in contract with a septic hauler to either they can be on call or monthly, however they decide to set up their service. And that information has to be submitted to us within a timely manner after they are serviced. We were able to, all of us are members of the Indiana Environmental Health Association. Our quarterly meeting last in November. It was November. It seems odd because November was so warm. We were able to go on a tour of the Journeyman Distillery. So that's always interesting to be able to see those different processes. We are allowed to inspect distilleries and breweries, so it was able to get a little bit behind the scenes there. That was a good meeting. That was a good tour. They do that. Those tours are open to the public, not necessarily the one we took, but they do have tours that are open to the public there and also in Michigan at their distilleries. So I would, if anybody has any kind of interest in that, I would highly recommend doing those. We had a number of new establishments, really only one new brick and mortar, the Drift on Pine, a new building. All the others were existing buildings. New concept at the Blue Chip. The buffet has been removed. That had been closed for several years. They did redo it, which required a new permit from us. So that's why that says new concept. That's not something we've probably have seen on there before. And the other, the Love's Travel Stop on 421 is open with 3 food permits there. Yes.
Is there still a buffet there?
No, ma'am, there's not. They've, that's that new Lakeside Kitchen. It's kind of the, when you go into it, it's, you order it yourself. There's no person to talk to. It's on a keypad. They have a big display there. You put in your order, you pay for it, and then you go and sit down and they bring your meal out to you.
Okay, thank you.
To go along with that, they are updating the food code after 15 years talking about it. We will have a new food code hopefully this year, and there will be a transition period, about a 6-month transition period to get everybody trained, not only inspectors but also us to get our establishments online with that. So Patty Nosek, one of our food inspectors, did attend a 2-day training in Indianapolis on that food code. And then we'll be having some more regional trainings here, hopefully in the next couple of months, just so we can start at least see what the code is going to be. Nobody's really seen what the code is and what the changes are. So the sooner we know and we can understand what those are, the better we can educate when we go into the establishments and get everybody up to par on those. There were a number of health educator outreach. There was 328 doses of Narcan distributed. That is a service that we offer. We can go into businesses or different community groups. They can contact us and we can go out and do that training, and at the end of the training you'll have a dose of Narcan with you that you can use. And 20 car seats that we were able to give away. We have a grant to purchase those. Anybody, doesn't matter who you are, can come and get your child properly fitted for the right car seat for their proper age and weight and height and all of that, free of charge. You just have to let us educate you and put the car in the seat for you and watch you take this car seat in and out to make sure that you know how to do it properly. We did have a new tattoo establishment go in. We did a number of lead investigations. Remember, we do have a certified lead inspector. So when we have a child with elevated blood level over 5, that we're able to go into the home and inspect that home to find areas of where there may be possibly, where that poisoning may be possibly coming from. So we're able to do 3 of those in the last quarter. So with that, I will pass the torch. I'll try to answer if anybody has any questions.
If there are no questions, do I hear a motion to accept the report?
So moved.
I'll second that motion.
Mrs. Arnold,
Aye.
Dr. Dora,
Aye.
Dr. Uhas,
Aye.
Ms. Lon,
Aye.
Dr. Manning Cox.
Aye.
Thank you.
Next is the nursing supervisor's report.
Good afternoon. As Dr. Ducey and I were just talking about, our reports are quite similar, so I will just briefly go over some of the things that I have that maybe she didn't talk about. So about the measles vaccination coverage, in 2022, the cases increased by 18% and the deaths have increased by 43% globally. So the number of measles cases is 9 million in the world and deaths to 136,000, mostly among children. In 2022, 37 countries experienced large or disruptive outbreaks compared with 22 countries in 2021. So we urge everyone to be up to date with their routine vaccinations, especially MMR, for their protection. And we do hear from our drug representatives that there's a lot of vaccine hesitancy out there now since COVID. And we may be losing some of our herd immunity among the populations. So that's kind of a little bit alarming. So of course we always want people to be up to date on their routine vaccinations, but with the hesitancy, sometimes that's a hard thing to make happen. The COVID cases seems to be increasing in the community based on the number of calls that we have been getting. The CDC did a study about long COVID, and 6.9% of adults have had long COVID, and 3.4% currently have long COVID as we speak. Women were more likely than men to have long COVID, and adults aged 35 to 49 were the age group most affected by long COVID. The percentage of adults affected by the long COVID varied by race and Hispanic origin. And adults with family incomes at 400% or more of the federal poverty level were less likely to have long COVID. And this is interesting, the percentage of adults who have ever had long COVID was lower in central metropolitan areas compared to medium and small metropolitan and non-metropolitan areas. And they were in the lowest, the long COVID cases were lowest in large central metropolitan areas. I did include a couple of charts with your report about different vaccines that are recommended, such as flu, COVID, RSV, who should get them, what they should get, and when they should get it. So I thought that might be helpful. And then the other chart is just on RSV. Which population does it protect, the type of product, and is it for everyone in the group? And the fourth quarter nursing statistics, I put them up at your stations up there. I wasn't able to get them out at the deadline, so you have them today. The blood profile clinic, we did 35 draws in the fourth quarter with one notifiable result. We did one safe sleep education and pack and play provided. We saw 459 clients for immunizations and did 826 immunizations. We saw 14 clients in our confidential services clinic. We did 75 TB tests. We investigated 66 cases of reportable communicable diseases. Saw 4 clients for international travel. And followed up on 7 elevated blood lead levels. Any questions?
Are there any questions?
I do have my own, just a little bit tangential. I've seen these wall-mounted electric cardiac defibrillators. I'm not sure that's even the right acronym. Do you know what I'm talking about, Jennifer?
Yeah, I do.
There's one.
Yeah.
In the hallway, yep.
Yeah. I see them in many places. Like I saw one at the gym not that long ago on the wall, proudly, does anybody know how to use them in the community other than EMS and nurses and doctors?
The ones that I have seen used are self-explanatory. It actually tells you, like there's a goofy little robot voice that tells you exactly where to put the pads and has a little picture and everything. I mean, it really is for somebody who's never done it before. So it's
Just
not
have to turn it on. That's the most important thing.
Turn it on.
Turn it on.
Some of the schools are also doing programs to show the kids how to do it because.
Doctor, we can't hear you. Dr. Ducey.
Sorry, it wasn't turned on. And I understand that some of the different charity groups and schools and that are also, I don't think it's part of the class actually, but provide classes to show how to use them. So they are, I think the biggest thing for the AED is that people have to understand is all you got to do is take it off the wall and then it's easy. People look at it, go, I don't know what to do. I can't do this. And if everybody realized how incredibly easy it was, as you just described, it's very frightening, but it's very easy
Yeah.
to use. And the biggest thing is people have to take them off the wall and turn them on. And that's the first rule of everything they teach. Turn it on. And they all got, there's a little bit difference, but there's big off and on buttons. Turn it on, and from there it'll tell you right exactly what to do.
So the units that we have, we did get a funding from the council earlier last year, from the council for, it was close to $70,000 to purchase AEDs for all of the public buildings, the county public buildings. So we now have one on each floor of our public buildings. I was able to purchase 26 units. And there is one of the new units is out here, and they all have been installed, and they really are extremely user friendly. As soon as you take it out and you open the lid, it turns the unit on and it starts talking to you and telling you what to do. And there are some very basic pictures in there. It keeps it extremely simple. There's a big push from every year. The Health Foundation of LaPorte has an AED program to purchase for non-for-profit. I had a brain fart there. Non-for-profit and for the schools. And I believe that's open right now. But there's been a big push, especially within the city of LaPorte, to get one in every building.
Has there been any feedback on it from the public or the police or EMS as far as how's the community doing with it? Are they comfortable? Is it as easy as we say it is? Any feedback at all? Any lives saved? Just curious.
I can answer that. I don't know about those statistics. I can check with EMS and see if they have any numbers.
Well, yeah. Only reason I ask is they're kind of everywhere.
They should be.
Places you wouldn't expect them, there they are. Like I said, in the hallway, at the gym. So it's good. It's good news, that we're doing something like that. Thank you.
Yep.
Any other question? Okay.
Can we accept the nursing supervisor's report?
Yeah.
I'd like to move that we accept the nursing supervisor's report.
Second. Vote.
Mrs. Arnold?
Aye.
Dr. Dora?
Aye.
Dr. Uhas?
Aye.
Ms. Lon?
Aye.
Dr. Manning Cox?
Aye.
Next is the attorney's report.
Thank you, folks. There's not a whole lot to report. We have 2 outstanding septic cases, both of which have motions of default filed. So we have a hearing set in March for one of them that's been pending for quite some time now, unfortunately. And the other one, I still don't have a hearing date, so I'm waiting for the court to give us one on that. Yeah, so sorry, I was going to launch into something, but there's really no need. I will likely reach out to one of the gentlemen and see if we can resolve this. Unfortunately, I haven't heard back yet, so I'll keep working on that. But until the court gives us a hearing, there's not a whole lot that we can do. But at least they are moving in the right direction. And finally, Tricia and I have the same number of cases. So that makes all the difference in the world. It's progress. Does anybody have any specific questions about any of these things?
When we have an open sewer situation case going on, what goes on with that construction? Is that something that's put on pause, or is it what goes on with that when there's an open situation like this?
Do you mean when there's a failed system where there's...
No, you said that there's an open case. You said that there was an open case. So what does that mean for the homeowner or whoever it is that owns that property currently?
Oh, I see what you're saying. Okay, well, we have 2 cases that are ongoing. Unfortunately, we're not receiving a response from either of the homeowners. Therein lies the problem. So a motion of default is just alerting the court that we've satisfied all of our requirements with our complaint. We put forward all of our evidence. We got the record made in that regard. What we're waiting for is a response from the other side. When we don't receive one, then there's a problem. So we alert the court that there's no progress, or nothing is moving forward, and we need the court to set a hearing so that we can decide how best to move forward. One of the property owners has an attorney. That's the one that's been ongoing for quite some time. The other gentleman, the motion for default was just filed in early January. I still haven't heard anything back. And like I said, we're waiting for a court date on that. Now, something else that's worth noting is we did have a hearing scheduled in December for the older case, but that one had to be continued. The court had to continue it because they had an issue of their own that they were dealing with. So that pushed it back several months, unfortunately. A lot of times, as you may recall at the last meeting, we had several outstanding cases, and luckily we were able to resolve those. So oftentimes these things do remedy themselves, but you need the communication, and without that, it makes it really difficult to do. Luckily, again, we don't have a standing health hazard at either of these properties. I mean, it certainly doesn't excuse the problem, but it does minimize the potential public health risk or the health and safety risk inherent in these situations. So that's a positive note. Did that answer your question?
Yeah.
Okay. Anything else?
Hear a motion to accept the attorney's report?
I so move.
I'll second that motion.
Mrs. Arnold,
Aye.
Dr. Dora,
Aye.
Dr. Uhas,
Aye.
Ms. Lon,
Aye.
Dr. Manning Cox.
Aye.
Is there any new business?
I have a request. I would like to, anytime we charge a fee, we have to have an ordinance for that. And we have to go to the commissioners and they have to have the final approval and say on that. Going through some of those ordinances, some of them are very old and there are multiple of them. And I would like to bring those all together back into one single ordinance. So we have one reference to go to, and then to update the fees that are appropriate and present that at the next meeting, if possible.
Sounds good.
Awesome.
Okay.
Thank you.
Any other new business? Is there any old business? Okay, we need a date for our April meeting.
So I do have some dates, if possible, to try and maybe for the rest of the year. This room does get very hard to book, and we would request that possibly we could pick either the third or fourth Tuesday of the month. So if we did the third of the month, that would be like April 16th, July 23rd, and October 15th. So the month would stay the same.
Say those dates again, the 16th of
April 16th,
July 23rd.
July 23rd, and October 15th would be the third Tuesday of each month.
Okay.
Or the fourth Tuesday of each month would be April 23rd, July 30th, and October 22nd. Historically, the board has always tried to meet on the third or fourth Tuesday of each month of the month that
Okay.
in the quarter.
Unless anybody has a conflict, the third Tuesday of the month is kind of familiar. That's what we've been doing in the past. If anybody else has a conflict, but I think that might be a good one.
Well, I think the third Tuesday of July is the 16th, is it not?
Yes.
Not the 23rd?
It is, and I believe that's probably Fair Week, and that's why we put it to the 23rd.
I see, okay.
All right, let me look at my paper calendar. So July the 16th does not work? Dr. Dora?
It's Fair Week as well.
Well, that's what they're
Okay,
saying,
okay.
but according
Yeah,
to the
county fair.
website I'm looking
Okay,
at,
so we move that one to the
The
23rd.
website is it the second week. We could.
yeah, the website says it's the 6th through the 13th of
Yeah.
July.
Okay, so it would be July 16th. Thank you.
Okay.
So we are going to go with the 16th?
We'll go with the 16th then.
Okay.
So it'll be April 16th, July 16th, and October 15th. Is that
13th.
13th?
Was it October 13th? Is that what that was?
15.
October 15th.
15th, okay. Does that work for?
I believe that's
Yeah,
good.
okay.
So far, so good.
Okay.
Okay.
Perfect. Then we will get those dates reserved.
Yeah.
Okay.
Thank you.
If there's nothing else, the meeting's adjourned. Yeah.
Lights are off.
Thanks, everyone. Have a good night.
Thank you.